Audio Jungle.
Alliance Hospital says it will build a world-class 200-bed capacity hospital with a University of Medical Science to equip aspiring young doctors in the country. The hospital's medical director, Dr. Otabor Christopher, disclosed this to journalists during a courtesy call on him by the Association of Nigerian Health Journalists in Abuja. He said this would enable the hospital to eliminate the syndrome of Nigerian doctors going abroad to practice due to a lack of standardization in the sector.
Patients, they are being supported.
Statistics show that out of 75,000 registered medical doctors in Nigeria, 40,000 are currently practicing outside the country. This has also resulted in a high number of people seeking treatment outside Nigeria, accounting for 500 monthly. Although they may have been embarking on medical tourism owing to a lack of information about the activities of Alliance Hospital, which has over the years been equipped with modern operational equipment with cheaper medical fees when compared to seeking treatment outside the country. Briefing the media on its planned project to bring treatment to the average Nigerian, Dr. Christopher said Alliance Hospital aims to provide efficient alternative health care to discourage patients from going abroad for treatment, as well as having well-trained doctors who will contribute their quota to the nation's economic development.
So, what are the facilities that we have? Currently, we have 66 bed space. We have 5 intensive care units beds. 5 looks very small. These 5 ICU. But if you know what goes into one ICU bed, you will know what 5 means. That means these 5 ICU beds with ventilator, they all have life support. That means at any time someone is not able to breathe, or somebody's heart stops, or someone is not able to take charge of himself, we take charge of him, of his life, pending when he recovers. And we have been able to save a lot of people. With these 5 beds, we get a lot of, maybe before the end of today, someone is going to call me again. Say, Dr. Otabor, please, do you have an ICU bed? I was doing surgery in my hospital. The patient suddenly had a cardiac arrest. We have revived him, but we need a place where we can take him to for life support. Just one ventilator costs about 20 million. Just one ventilator. In the UK, ICU stay in a day is 15 to 20,000 pounds. Just to stay in ICU bed for one day. The US is about 25,000 dollars. So we also have special care baby units for those children that are born premature. Before they are able to support themselves, we support them. Sometimes we also take over their breathing and all that. From ICU, people don't go straight to the ward, they go to high dependency unit, like a step down ward, before they go to general ward. So that's a picture of our ICU with the machines and the beds. That's the special care baby units with the ventilators. So, in terms of diagnostics means finding out what the problem is. If you're able to discover what the problem is, many times over 50% of the job is done. And there's a big problem, there's a big gap in that space in Nigeria, because not too many centers have the equipment to accurately diagnose a problem. So you find people throwing medications at something, they are treating malaria and typhoid, and something is going on underneath, because they don't have the equipment to diagnose. But we invested heavily in diagnostics. So in 2015, we acquired the 0.4 Tesla MRI scanner. That's $500,000, the MRI machine. And since that time, it's just been awesome. The machine is so versatile. If someone falls or had an accident, bleeding in the brain, you put them in the machine. It will show you exactly the location of what's happened because the skull, you can't go in. But the machine takes a slice of body parts and reconstructs it in a computer so you can see what you are dealing with. It's so wonderful. It has saved a lot of lives. Then we also had a 16 slice CT scan before, but we discarded that, and March this year, we acquired a 64 slice CT scan. This came at 400 million naira from General Electric. So you can see that the equipments are not cheap. And that's why you don't have too many hospitals that have some of these things. Then we have digital X-ray, we have ultrasound scan, echocardiography machine. That's to check how the heart is beating, and EEG, ECG, and then of course endoscopy. So that's the CT scan on the left. And then that's the MRI scan. The MRI scan is 21 tons. That's the heaviest thing I've seen. But the MRI is 21 tons. When we're bringing it from Lagos, and it's 90% magnet. We have to dig 1.5 meters below the foundation level of the building to bury the magnet. In terms of operations, because we are big on surgery, it's a surgically based hospital because I'm a surgeon, and also because to a large extent, one of the core reasons why people get to travel in this country is because of surgery. So we are creating a local alternative. So that's why we're also big in surgery. So we have 4 operating theater suites in this hospital, 4 number. 2 of them are in the main block, 1 in the O&G side where they deliver babies and do cesarean section and myomectomies and all. And then 1 is in the IVF center.
He is optimistic that the hospital's ground laying ceremony, which will take place later this year, is expected to be executed within 10 years to meet the needs and aspirations of Nigerians in the health sector. Vincent Okushi, reporting for Quality Television.